Today's focus is on the secondary survey, a more detailed check of a casualty after the primary survey has ruled out any immediate life threats. It's also called a head-to-toe check and helps to identify hidden injuries. And we'll start with a brief history. What happened? Where is the pain? Did it have any medical conditions, allergies, or medication? Then perform a full physical check. Start at the head, look for bleeding, bruises, or swelling. Check the neck, shoulders, arms, chest, and abdomen. Observe gently, feel, and ask questions. Look for deformities, tenderness, open wounds, or changes in skin color. Move to the pelvis, legs, and feet, and always compare both sides. Finish with a full set of observations: breathing rate, skin condition, pulse, and consciousness level. Keep the casualty warm, still, and reassured, and a thorough secondary survey helps to detect problems early and informs emergency services. Stay observant and stay prepared.